The U.S. is experiencing a surge of new coronavirus cases, and it's posing a danger to unvaccinated Americans. For the first time since May, the country has recorded 20,000 new cases for several days in a row. Health experts fear cases may keep trending higher because fewer than half of Americans are fully vaccinated. The biggest clusters of unvaccinated people in the U.S. are in the Southeast and Midwest, but not exclusively. Los Angeles County is reporting exponential growth in cases, jumping 165% over the past week. Dr. Stephen Parodi joins me from San Francisco, is the Associate Executive Director with the Permanente Medical Group at Kaiser Permanente. Thank you so much for joining us, Doctor. So we're seeing the rise of the Delta variant, mostly in the South, in places like Missouri, where the vaccination rate is extremely low, but also in California, where it's now the dominant variant. Probably the best example is LA County. It's reported the highest number of cases in months. Now, you know, in fairness, it's still way lower than what we saw during the peak, but I guess it's the rate at which it's increasing that's worrying experts. So the many hospitals that you help manage, they treat millions of patients across the state, so you get a great overview of what's happening. So what are you seeing?
Well, it's really clear that the Delta variant is much more transmissible than before. We were talking about it as an abstraction about a month ago, and now it's become the predominant strain in the United States and is quickly going to be that in California as well. In California, I can say that because we've got higher vaccination rates, while we've seen increases in hospitalizations, we're at really 10 to 15% of where we were at the peak back in January. That's different and in contrast to other parts of the country where we're seeing, particularly Missouri, as you called out, running out of hospital beds or running out of ventilators. So the key message here when it comes to the Delta variant is that if you're unvaccinated, you're at high risk for getting infected and getting hospitalized and potentially dying from it. If you're vaccinated, you are seeing lack of illness and lack of hospitalization. In fact, 99% of the hospitalizations that are occurring right now in our Kaiser Permanente system are in people that are unvaccinated.
Yeah, that's a very important point to make, and I think that 99% is we're seeing that practically across the country. But if it weren't enough, the Delta variant, now there's in California the Epsilon strain to worry about, I understand, which seems to make the vaccines dramatically less effective. So as an infectious disease specialist yourself, what can you tell us about that?
Well, so this virus is doing what viruses do. If they're allowed to circulate around, they form new mutations. So the Epsilon variant is yet another version of that. Fortunately, even with the early studies, and we know that the Epsilon variant has been around in California since May, it has not become the predominant strain. And neutralizing antibodies are still made even with the vaccines. So my key message here is that the way to get this under control is to get vaccinated. And even if there are fewer antibodies made, you still have protection with the currently available vaccines we have.
Yeah, I mean, getting vaccinated is the key. There have been sort of different ways to sort of reach those people who haven't been vaccinated. Some say going door to door to encourage people to get vaccinated. Other people are suggesting that getting the vaccines fully approved by the FDA would help. What do you think would make the most difference?
I think what I've been finding is that it's literally making those personal connections. At this point, everyone's heard the messaging, and it's really reaching people where they are. So it's either getting the vaccine into the community directly, where people have transportation issues still, and or the ability to access health care. But more importantly, when it comes to the hesitant populations, it's actually listening to their stories and understanding where they're at. And maybe
before we go, sorry, I just want
connection.
Before we go, I don't have much time, but I did want to get your input on this because this has been a big story this week. The confusion over the boosters. We heard Pfizer's CEO announce its vaccine loses efficacy over time, so we'll definitely need the booster. CDC and FDA came out quickly and said no need for a booster. So there's been a lot of confusion created in a public already confused about mixed messages over COVID. So what's your Do you have any fears here that this might sort of undermine public confidence in the shots?
My take on this is that the boosters are something that is really going to be something we're using later on when there is a true vaccine variant that escapes. Right now, we've got vaccines that are effective. The durability of the vaccinations are up to a year and perhaps even longer. So right now, our focus needs to be on getting people who haven't gotten vaccinated. And when we get that emergency use authorization for those children, the 6-month-old to 11-year-olds, especially since they're going back to school, getting them vaccinated. That's really the order of the day.
Absolutely. All right, that is all the time we have, but really appreciate having you on, Dr. Stephen Parodi. Thanks so much for being with us.
Thank you so much.